Data makes it clear that African Americans are disproportionately affected by the coronavirus pandemic. A statewide strike force is working on a plan to combat that. And every weekend, the Center for Closing the Health Gap hosts a virtual town hall about resources that are available. Courier publisher Jamie Smith talked about that with CEO Renee Mahaffey-Harris.
Thank you, Kyla. Renee, I'd like to thank you for being with us today to talk. You know, I think your mission is very important, and I think getting your perspective to our community is really important as well. Can you tell me, what do you think the COVID-19 economic impact is to businesses in our Black community of Cincinnati?
Well, I haven't seen any of the economic modeling, but, you know, as I listen to experts across the nation, and the director of the Courier Institute wrote an interesting story about the economic impact. Do we return? If so, what does it look like as the Black community? And economically, we, frankly, economically, from a wealth perspective, have a very small percentage of wealth. And therefore, the impact on our businesses not being able to be open and whether or not they come back is really in question. And then what does that mean to the Black community in particular? Because when you look at the issue of health disparities, the preponderance of the factors that contribute to health disparities are our socioeconomic status, our socioeconomic capacity, our ability to have housing, education, good jobs, or jobs at all. All are the biggest factors that contribute to the disparities in health that we see in this nation.
Okay. You know, we talked a little bit off screen about, you know, the name of the organization itself, the Health Gap, or Closing the Health Gap. What do you see? I think it's a big mission, but what do you see is your role right now during these times?
Well, I believe that this time there is no better evidence of why we exist. The Center for Closing the Health Gap was created to lead the efforts to eliminate racial and ethnic health disparities in greater Cincinnati. And that's not done alone. That is done collaboratively. Across this nation, the issue of disparities and the conversation on disparities really began with Secretary Heckler under the Reagan administration. And she had a data set and a study with 18 months of evidence that showed that despite socioeconomic status being equal, so you take a Black person and a white person, woman, we'll take a woman or man, same income, same education, the health outcome will be more disparate for that Black person, man or woman. And so evidence, so they did a lot of study because it's like, this can't be true. Like, how could this be? So many of the systematic and structural factors that contribute to why that exists are going to take time, policies. And, you know, Dr. Fauci, when asked the question, why is the disparity greatest in the Black community with COVID-19? Like, in some cases, 70% of the cases are the Black community, where they represent a very small percentage of the city. And he said, how long do you have? Because the issue of health disparities didn't just begin. The light is just now shown on it in our country. And our city is, you know, most national data bears out locally. However, we do have to do our own data gathering and tracing and work to understand the disparate impact in Cincinnati in this region. So that's why I think that today and for time to come, the issue of the health disparities will need to be an issue that's elevated as a crisis point in our nation and in our city and in this region.
How are you continuing to address those disparities? I know you probably sometimes feel like you're on a treadmill that's going the wrong way.
Well, you know, first of all, the silver lining for me in this time is the fact that we are coming together, that we all recognize, I know there's many slogans that say we're in this together. We really are. We're interdependent. And I think now we're seeing that we truly are interdependent. And as it relates to addressing the disparate impacts in the Black community and brown communities of our region, we see that we got to do it together. And so an initiative was launched. I won't say an initiative, a collaboration was started. Once we learned that we had a national emergency, I reached out to Eddie Keon with the Urban League, Joe Mallory with NAACP, Eric Kearney with the African American Chamber of Commerce, and our newest council member, Jan Michelle Lemon Kearney, and said, you know, we got to make sure that the information gets out to our communities in particular, and it needs to be from a trusted source. So we launched COVID-19 communityresources.com, which is a site that is growing with now over 25 different organizations being in collaboration, along with the Cincinnati Medical Association, which has an Ask the Doctor feature. One of the biggest questions that we all were receiving was, I don't understand what to do if I have symptoms. I don't understand if I'm eligible for testing. I need food and I don't know where to go. I need to apply for unemployment and I'm not really sure how to do that. I have emergency resource needs that I'm not really quite sure how to direct to. And this site has 7 tabs and lots of videos to make it simple to connect to the information that people need in the Black community from a trusted source. And so I'm so proud of the work that the Urban League and African American Chamber of Commerce and the NAACP and the Cincinnati Medical Association and again, our newest council member, Jan Michelle Lemon-Carty, coming together. And it's building. So, there are now almost 25 organizations, including the COVID-19 sites of all the hospital systems are there. We are also communicating with the hospital systems. I know we meaning the Health Gap are and others. The health departments of both the city and county, their sites are a part of this site. And it continues to grow. Our goal is to also have information. So we have weekly town hall meetings. We finished part 6 last week with our U.S. Senator Sherrod Brown, and he said, wow, there's some really tough questions asked from the residents and from this region, and it just tells us that people need information. They need to really understand what is being done at the federal level, what is being done at the state level, what is being done at the local level, and that how can they be participatory in that process and ensuring that their needs are understood and are addressed.
Well, you know what? The thing that I like the most about that, and you and I talked earlier this week, and you cruised me through the site, the collaboration piece is so incredible. And that's how we're going to address these disparities. That's how we're going to close the gap. That's how we as a region are going to succeed, is more regional collaboration. So thank you for being such a strong leader.
Thank you.
For your cause, and we need to get you on here again soon. Maybe we can talk soon on the next interview about how businesses can help you lead your way. Thank
you, Jamie.
Today.
Thank you. Day.